exams are important because it helps to establish a relationship with your doctor. And your doctor gets to keep up to date on any medical changes that you have throughout the year.
Why did the doctors talk to the patients?
Any problems that you might be having throughout the year. But then when you come in for an actual problem, if we know your background and you've done preventative health exams,
What did they say to them?
then it's much easier for us to pick up and kind of pinpoint where the problem might be. In terms of ages with preventative health exams, there are different exams that we do for women and for men, of course, and even for men, it can be a different exam for a young man versus a different exam for an older man. Same thing with women. And then for children, of course, we're always checking immunizations and making sure that they're meeting their milestones. So,
how did they know the general exams would help?
yes, preventative exams are different for age groups and then based on being a male or female as well. We want to find any stages of early disease. So it happens all the time where someone will come in for preventative exam and we'll find that they have high blood pressure. We'll find, of course, that their smoking or drinking habits aren't appropriate. Or when we do our labs, our screening fasting labs, we can find high blood sugar, which would indicate diabetes, or high cholesterol, which puts it at an increased risk for heart attack, stroke as they age. So,
should there be more tests?
What happens all the time where people come in for a preventative exam and we find disease processes that we need to be addressing. The typical health maintenance exam is going to start off with a history. We're going to get your background information, we're going to get your family history, your personal history, any medications that you might be on, allergies that you may have. And then we're going to move to a physical exam, which is going to include the very basics in terms of blood pressure, your height, your weight. Then after that, we move to the other part of the physical exam, which would include a simple head-to-toe exam, which would be a screening exam, where we look at your eyes, your ears, your nose, we listen to your heart and lungs.
I think I'll try and see my doctor more.
Examine your belly, just to see if there's any overall problems that we might need to address. It's extremely helpful when they come in for their health maintenance if they know their family history, because that's very important for your overall risk. If you know your medicines, and if you have a list of surgeries and things that you've had done.
I realize that they can find disease.
All of those things are basic history questions that increase your risk for other things that we need to address, so that's important. Another thing that's important is if you have any specific questions that you want to ask, because a lot of times between the car and the physician's office, you totally forget what you wanted to ask. So if you have specific questions, be sure to write them down and we can address them. What can be problematic sometimes is if you have a list of 10 problems, that's where we recommend that you come in throughout the year as well to address specific problems.
I wonder if I have major health issues.
The relationship is extremely important between the physician and the patient because as we know our patients, we can determine what your risk is because we know your past history instead of trying to reinvent the wheel, every time.
Maybe I'll need to see my doctor more next time.
We can, if we know your history, a lot of times as a family practice doctor, I know your family's history. I may even know your family. So it allows me to curtail my treatment for you better, your expectations of the visit, and what treatment path I might want to take in terms of diagnosing you, treating you, and further follow-up.
This is similar to a school test.